Today we're going to do a castration and a Dewclaw removal. Dewclaws are sometimes little floppy things on the dog's back and feet, and if they're too floppy they can get caught up on things. So we're going to do a castration, and why you castrate male dogs is, gosh, honestly I'm not tired, I haven't been drinking, but I was trying to concentrate on the camera and put on my gloves, and obviously that was difficult for me today. Anyway, castration, why we castrate male dogs is, well, the answer would be because you can't castrate female dogs, right? But why we castrate male dogs is because they can become humpy and aggressive, and they lose their mind when a female in heat is in the area, and that's the reason why we castrate male dogs. So we're going to do that today, and also remove a Dewclaw, and I'll show you about the Dewclaw after the castration. We're gonna put on a couple drapes here. This little dog, I mean, you have to get a real tiny drape for this little thing because it's just a tiny little Dewclaw. So we're gonna keep the Dewclaw a little sterile, and then we're going to drape the castration area too. So these are all paper drapes. Some vet use cloth drapes, some vet use paper drapes. It's all it is to make sure the surgery area stays nice and clean. There's the cute little testicles, and we're going to remove the testicles in front of the scrotum, and we're going to ligate, we're going to put ligatures on them so that they don't bleed, and these are the towel clamps that go right into the skin, right, so it holds the drape on, and then this whole area has been prepped and scrubbed. Get out the instruments we might use to help us with this. Before I start the surgery, I often, and several times during the surgery, I look down at the gums from where I'm standing, and Isabel, our technician, is of course monitoring everything to see how they're nice and pink, and she presses and the color comes back. And then see the monitor for the pulse oximeter is on the tongue, and you can see the heart rate's 124 and the oxygen in the blood is 98. And you can see the spikes of the EKG are nice and regular. There's no erratic spikes that, when you look at an EKG, you just want all the spikes and the curvy lines to look the same. And that shows you that the EKG's in a really good, or the heart's doing a good job. So what I'm going to do is I'm going to, these are little tiny testicles, so they're a little tough to get. This dog was starting to show some aggressive tendencies, so the person wanted to castrate as soon as possible. I'm going to push the testicle up under the skin above the penis, and I'm going to just make a little incision right in the skin, and then this little testicle is just a tiny little thing, but we're just going to, it's like a little bean. We're going to go ahead and cut around the tissue under the skin to release it. So here I've released it, and I'm pulling it up, and then I strip off the connective tissue, the holding tissue that holds all this stuff into place, and I put it right down there, and then I'm going to tie a ligature. Ligatures they're pieces of suture that wrap around the arteries and veins, so that I'm trying to do this for you, but for me I put it over here. So come here, little testicle, stay over there. So we're going to put a ligature on it, and how you do that is you wrap it several times around the instrument, and then you grab the actual end of the suture, and then you pull, and it makes a knot. And then if you tie several more times, it completes the square knots. Sometimes we use double ligatures, but in this case, this tiny little testicle will only need one ligature. So then I'll cut the knot close to where the, so you can see it, I cut it close to where the knot is. And then I will take sometimes we'll put a clamp on, but in this case, for this tiny little testicle, I probably can just cut because, and the cord's long enough that I can look and make sure it's not bleeding. It's not bleeding. And this little testicle we'll put right over here. And then we'll go in and push the other one up. The other one's up right here. We're going to push that up and cut and make a cut. So let me clean up my area. Get my suture over there. Push up this little testicle, because it's a tough surgery. It's a little tough surgery to get that little testicle into place. We're going to cut, release it from its attachments until it doesn't want to come out. It says, "Oh no, don't make me." So sometimes you just have to just lightly go over the top of it until it releases it, and then you can see the tissue that you're getting away from it is right there. So sometimes in order to just keep it in one place, I'll put a clamp on it, or most times I'll clamp on bigger dogs. I'll certainly put double or triple clamps on them, but this little dog, like I said, you don't need a lot of instruments because it's just so tiny. So we're bringing this little suture on the other side, and we're gonna tie it off. Again with a square knot. So that's the first knot, second knot, third knot, fourth. Going to cut the knots close to cut the suture close to the knot. And then we're going to cut above the ligature, so that's tying out the artery. If we cut down here, it would bleed. So we're going to cut above the knot where the blood stopped and make sure it's not bleeding. And you can put the testicle, I'll put the testicle over here, and then there's some ooze, a little tiny bit of oozing from the connective tissue we cut, but you can see there's no real bleeding. So now what we do is we put a couple sutures in to close up the wound. And you can tell in a castration it's not really open to the outside or inside the body, I mean. So if they lick this thing open, it's not like it's in the abdomen where it's going to expose all the tissues to infection. It's just, there's the penis or the connective tissue above the penis, and then those cords go into the abdomen but through the inguinal canal. So in the subacute stitch, or the one under the skin, we go up first. We check to make sure we haven't gone through the skin. So I'm going in the connective tissue. And then we're going to go on the other side and go down. That way, the sutures are pointed downward so that when we tie them off, they're not sticking above the skin line, they're buried down in the tissue. So I'm going to start it with that. See if we can get it to get the thing, see if we can get the skin to pull together nicely. And this little puppy's real small, so sometimes I have to put a couple different sutures in. You can tell it closes up nicely. We can glue it. Those sutures underneath are to hold the underneath of the skin together. They're actually more important than surface sutures in most surgeries. So again, I go up on one side, then we go down on the other side. And then we pull it together. It's just such a tiny thing, isn't it? Poor little guy. So we're gonna tie it, and then we'll probably glue it. I don't use a lot of sutures sometimes with smaller dogs because there's a lot of suture reactions. A lot of suture material. Sometimes the less suture material, the better in some small breed dogs. So, what is this? This is so after we finish the suturing under the skin, we're using more and more tissue glue for routine procedures. It's vet bond, and it's blue, but it's a lot like crazy glue. But you don't want to put it inside the incision, you just want it on the top. So I kind of push it down through. See that drop? You just want it to hold the top. Now I got to get my fingers off before it starts to dry, or else I'll be going on with the puppy all stuck to this, and they probably don't want that. So I'm going to take off the clamps now, and we're going to remove this, and you can see the little pup all stretched out there. Just kind of in a blissful sleep. And then I'm going to take my drape that I put down here, and we're going to expose this Dewclaw. Now, Dewclaws in some dogs are very big and very connected, and some of those don't need to come off. But sometimes when the Dewclaw is just a tiny little thing like this and it's floppy, what I mean is if a Dewclaw has no bones like this one doesn't, this thing's gonna get caught in a branch and ripped and bleed. Right now it's very small, but as the dog gets older, it may get big enough to cause a problem. It's just skin that is holding it there. There's no bone inside, so it's easy to put my scissors there and make a cut. And you can see, here's the Dewclaw. Put that there so you can see it. And then there's the hole. Look at that. That's hardly anything, isn't it? So I could put a suture in that, or maybe we'll just put a little vet bond on it, because that's hardly anything to sew up on this tiny little puppy. So we'll put a little vet bond on there, and that should heal up fine. We'll probably put a little bandage on there too, because puppies tend to lick little wounds, and if they lick that wound, then they might open it up. But that's just a little poke. That's hardly anything to worry about. That's more like a dog can get hurt worse playing with its littermate. So anyway, so we went ahead and we removed both testicles. You can see the glue's holding nicely. Can't pull it apart. There's very little oozing. Here's the sac, so we push the testicles up and we cut a little incision right above the penis. We pull each testicle out. We put suture around it. And so now this puppy doesn't have testosterone to cause it to get aggressive or humpy and all those things that bother him. Some dogs, if you have a large breed dog and you're thinking about hunting it or thinking about working it, some people are leaving dogs not castrated longer in order for the testosterone to help strengthen the muscles, tendons, and joints. So that's a good thing. If I had a working dog, say if I wanted to hunt or wanted a dog to jog with me, just wanted a dog to be stronger, you could probably wait till you're old. The downside of that is that when we do surgery on older dogs, sometimes they bleed a little more and they have problems. So the downside is, even though it's probably better for their joints in general to leave them not castrated, if they're not humpy and aggressive and lose their mind when females are in the heat in the area, then that might be a good thing. But when we castrate older dogs, sometimes there's a lot more complications, because look at this little thing. I mean, that's hardly any wound. How can that be complicated? But what'll happen is, this little one with his, if he doesn't wear a collar and if that thing hurts a little bit, he'll lick it, and they're their own worst enemies. So, and older dogs can be the same way. Anyway, I hope you enjoyed it.
Well, I hope you enjoyed my video on castration and the Dewclaw removal. I just wanted to recap the reasons to castrate are if a dog shows any fearful aggressive behavior or tends to want to run off when he smells the females in heat in the area. Castration will remove those urges and desires and fighting behaviors that might be harmful to your pet and harmful to somebody in your family. So it's always good to consider that. One thing that veterinarians and breeders and trainers are thinking about now are to wait if a dog's going to be worked hard, or a dog you might jog with, or just a dog that likes to retrieve or run on the beach. Sometimes strengthening those joints and ligaments and leaving them not castrated till they're a year old might be a good thing. The one drawback is bigger dogs will tend to be a little bit harder to do surgery on and have a few more complications. But if it makes their joints and their bones and their joints and their ligaments stronger, it's a good trade-off. The slight risk of prostate cancer when a dog gets older is often the reason why we castrate dogs in general. But there's some new thought that maybe the stronger joints are a good trade-off for the small risk of prostate problems. And the Dewclaw removal, dogs that have floppy Dewclaws hanging from their feet, especially when puppies, check that out, because if the Dewclaw isn't well developed and is just bound by skin and not held in, it will sometimes tear. A lot of people say dogs need the Dewclaws for traction, but it's if they're floppy and loose like the one in the video that I showed, it might be better to remove it. So anyway, well, and there's one more thing. There's a study recently that even shows that not castrating animals might decrease bone cancer. It was just one study in golden retrievers. So we're coming full circle on castration. Maybe leaving some dogs intact is not such a bad thing. Besides, most of the overpopulation of dogs doesn't come from good owners like you all that are watching this video. It comes from people that let their dogs run loose, and or in countries where the dogs aren't so much house dogs, they just run around and breed at will. Well, anyway, we'll have a great day. Check out Dog Dish Diet, or Google Dog Dish Diet, or Feed Your Pet to Avoid the Vet. Dog Dish Diet is about feeding dogs better, with some ideas for cat nutrition in there too, to reduce allergies and skin problems and obesity. And Feed Your Pet to Avoid the Vet is all about home cooking for your dog and cat, or what human foods you can feed it, and ideas on skin allergies, and ideas on urinary problems with cats, and urinary problems with dogs. But anyway, well, have a great day, and enjoy your pets.